When you are hit by something, you feel pain. But have you ever wondered what pain is? Pain is an uncomfortable feeling that tells you something may be wrong. It is an unpleasant sensation and emotional experience usually caused by tissue damage. It allows the body to react to and prevent further tissue damage. It can be steady, throbbing, stabbing, aching, pinching, or described in many other ways. Sometimes it's just a nuisance, like a mild headache. Other times it can be debilitating. People feel pain when a signal travels through nerve fibers to the brain. Simple, everyday activities like walking, swimming, gardening, and dancing can directly ease some of the pain by blocking pain signals to the brain. The activity also helps lessen pain by stretching stiff and tense muscles, ligaments, and joints. It's natural to be hesitant if exercise is painful and you're worried about doing more damage. But if you become more active gradually, it's unlikely you'll cause any damage or harm. When you start gentle exercise, the pain you feel is because the muscles and joints are getting fitter. But now the question is how to get rid of this pain very quickly. Pain is compassionate and can put you in a very confusing situation. This is why anyone may want the pain to go away very quickly. That's why at this time, we use different types of painkillers. What kind of medicine or natural remedies you will use to treat your pain depends on the type of pain you have. And we resort to various types of painkillers like paracetamol or some natural remedies without any prescription or advice. But which is the best painkiller tablet? We can use different types of painkillers such as paracetamol, aspirin, diclofenac. These painkillers are often used in our daily lives without a doctor's prescription. But the question is whether we are using these painkillers in the right amount the right way. Let's talk about those 3 painkillers. Number 1. Paracetamol. Paracetamol is known as acetaminophen in the USA. Acetaminophen relieves mild to moderate pain, headache, and fever. It is available as brand names such as Tylenol, Mapap, or Panadol, and also as generics and store-specific brands. Paracetamol is used to treat headaches and most non-nerve pains. 2 500 mg tablets of paracetamol up to 4 times a day is a safe dose for adults, but never take more than 8 tablets in a 24-hour period. Overdosing on paracetamol can cause serious side effects, however, so do not be tempted to increase the dose if your pain is severe. Number 2. Aspirin. Aspirin is a non-steroidal anti-inflammatory drug. It was the first of this class of medication to be discovered. Aspirin contains salicylate, a compound found in plants like the willow tree and myrtle. Its use was first recorded around 4,000 years ago. Aspirin reduces fever and relieves mild to moderate pain from conditions such as muscle aches, toothaches, common cold, and headaches. It may also reduce pain and swelling in situations such as arthritis. It reduces or completely prevents the production of prostaglandins, a pain and inflammation causing chemical found throughout the body. However, paracetamol targets the prostaglandins found in the brain. Aspirin, acetylsalicylic acid, is a non-steroidal anti-inflammatory drug. Number 3. Diclofenac. Diclofenac is a medicine that reduces swelling, inflammation, and pain. It's used to treat aches and pains, as well as problems with joints, muscles, and bones. These include rheumatoid arthritis and osteoarthritis. Reducing these symptoms helps you do more of your normal daily activities. This medication is known as a non-steroidal anti-inflammatory drug. It is also used in the treatment of chronic diseases such as arthritis, although with the advice of doctors. This medication is definitely not recommended for those under 14 years of age. This is because it can increase the risk of a serious condition called Ray's syndrome, which can appear after a viral infection such as a cold, the flu, or chickenpox. Ray's syndrome can lead to permanent brain injury or death. However, a clinician may prescribe aspirin to a child under supervision if they have Kawasaki disease or to prevent blood clots from forming after heart surgery. For children, doctors usually recommend acetaminophen or ibuprofen in appropriate doses instead of aspirin. There are also some natural ways to relieve pain, and the best part is that it has no side effects. Many people with arthritis want to treat their joint pain without the expense and potential side effects of medications. There are several natural ways to decrease pain and improve day-to-day living. Try one or a combination of these approaches and see what works for you. Your body is designed for movement. Gentle stretches can help you keep pain at bay, so stretch yourself. You also can meditate, because meditation is a quick, simple, and free way to relax, which involves a source giving you suggestions to guide your meditative thoughts. Some people practice acupuncture, which is an ancient Chinese healing technique. While it is not well understood how it works, some people report that it helps reduce their chronic pain. You can also apply heat or cold compresses to reduce the discomfort or inflammation of the arteries. It can slow down nerve impulses and distract the brain from the pain. In our daily life, we get pain in many ways during sports or exercise, and many people suffer from arthritis. We can easily cure these pains with some simple methods, which are mentioned above. Subscribe to our channel and click the bell icon to get more updates. Until then, stay with Health Conscious.